Okay, today we're going to discuss the disorders related to your coagulation factors. So we can classify the disorders here related to your coagulation factors as either localized versus your generalized. So pag localized, mean to say sa a particular part lang ng body natin. Pag generalized, okay, so throughout your body. Mucocutaneous versus your anatomic. So pag mucocutaneous, most likely mga superficial hemorrhagic manifestation lang siya. Pag anatomic is more of the internal. It try to penetrate deeper ang ating bleeding manifestation or disorders. Acquired versus your congenital. So congenital is more of genetic disorders and acquired is more of madami. Pag ito ay, this one is involved only here once or a single coagulation factor problem. Pag acquired, most likely that one is it's a type of bleeding manifestation or coagulation factor disorders which involve several coagulation factors. Madami sila. Okay, we'll discuss each of the different types of our bleeding manifestation. So, localized bleeding, again, this is a pinpoint bleeding here, bleeding from a single location or pinpoint lang. So, mean to say, particular part lang ng body natin. It doesn't involve throughout your body as manifested by the bleeding disorders. Okay, so the problem with your localized bleeding manifestation could be in the primary hemostasis. That could either be problem with your blood vessels or defects with your platelets, both your quali and quantitative na defects. Pag sinabing qualitative, pag qualitative ang platelet na defects natin, you have a normal na platelet count. However, hindi sila nagpa-function. And therefore, nagiging ano lang sila, nagkakaroon ka pa din ng bleeding manifestation because of that. Even you have a normal na platelet count, pero hindi, ang problem is in the function itself, so hindi siya nagpe-perform ng kanyang involvement in your clotting process or your hemostasis. Quantitative defects could be mababang platelet, that's thrombocytopenia, or mataas ang platelet, thrombocytosis. And another one could also be related to your problem with your coagulation factors. And all this one lead to your localized bleeding manifestation. Okay, then we have also here your mucocutaneous. Okay, your mucocutaneous is just equivalent to your generalized. Okay, this one is generalized mucocutaneous and even your anatomic. Basta pag generalized, it involve here different part of your body, madaming affected na area. Pag localized, so isang part lang ng katawan natin. So your generalized could eventually be mucocutaneous or anatomic. So depende sa lalim ng manifestation ng bleeding natin. If it involves here the superficial lang na surface ng katawan natin, so it become here your mucocutaneous. This is still your generalized systemic manifestation, only that it's superficial manifestation. It do not involve your internal organs. So that may be related to your primary hemostasis problem only related to your blood vessels or your platelets for both the quali and quanti. Manifestation, PDK, so red small spots, may mga red spots sa skin natin. Pinpoint hemorrhage, purpura is also pinpoint din. Parang siyang PDK natin. Or mga red spots. Epistaxis, that's your nose bleeding. Bleeding of your gums is another manifestation of that. Anatomic hemorrhage on the other hand, so again, this one is a type of your generalized na bleeding manifestation where it involves here the internal organ in our body. So, mas deeper ang kanyang bleeding, affected na bleeding manifestation, affected na area in your body. It involves here your internal organs, soft tissue hemorrhage, and usually pag anatomic hemorrhage, more of coagulation factors ang problem natin. Secondary hemostasis, so ang problem with this one is more of your coagulation factors na problem. Okay, we have here the investigation of your coagulation factors. So, in order for us to determine what coagulation factors is the defect with the patient, we could perform here your screening test, or you could also confirm that one by your specific coagulation factor assay. So, for the screening test will detect here the group of your coagulation factors problem. So example of your screening test, we have your activated partial thromboplastin time. So that one will detects here the problem with your intrinsic pathway and the common pathway. So lahat ng problems sa intrinsic pathway, again, intrinsic pathway, factor 12, 11, 9, 8, common pathway 10, 5, 2, 1. So pag mababa ang level ng ating ganitong mga coagulation factors, then it will have a prolonged result for the APTT. On the other hand, prothrombin time will detect the problem with your extrinsic pathway and the common pathway. Extrinsic pathway includes your factor 3, 7, 10, 5, 2, 1. So, pag may problem ka doon, it will also increase the prothrombin time. It will have here the abnormal results. Then we have also your thrombin time. Thrombin time will try to detect the problem with your fibrinogen because remember your thrombin, that's the one which try to hydrolyze your fibrinogen to your fibrin clot. So pag may problem ka sa fibrinogen, like mababang fibrinogen or wala siyang fibrinogen, it will have here prolonged na test result for the thrombin time. And we have this special test. This will determine specifically here why coagulation factors will be defective or absent. Like for example, ulit sa APTT natin, madami, di ba? Like factor 12, 11, 9, 8. So, hindi mo alam kung alin doon ang pinaka-problem. Then, gagawin mo ay you're going to perform individual na coagulation factor assay determination. How are you going to do that one? Determine mo ang concentration ng factor 12, factor 11, factor 10. Kung ano mababa as compared with the normal, that will determine kung ano ang sakit ni patient natin. Okay, so screening test will detect the group of your coagulation factor problem and you check that one kung ano talaga doon sa group nyo, sa group ng defects niya, then you perform your special coagulation factor assay like factor 12 assay, factor 11 assay, factor 10 assay, which are highly specific for determining each of the concentration of your different coagulation factors. Another classification of your bleeding manifestation or coagulation factors abnormality could be your congenital or acquired disorder. Pag congenital, the problem here is, again, this is a single na coagulation factor problem. There could be a qualitative or quantitative. Again, pag quali is in the function, pag quanti is in the concentration ng problem natin. So, pag congenital is a specific coagulation factor problem, so one or a single coagulation factor problem lang. For example, Hemophilia A, so ang problem natin is your factor 8 lang. Hemophilia B, ang problem natin is your factor 9. And your von Willebrand disease is only related to your von Willebrand factor na problem, mababa. Pag sinabi naman natin acquired disorders would eventually basically try to be problem with your multiple coagulation factors. Sobrang dami nila. Example, we have your vitamin K deficiency. Again, your vitamin K deficiency will be problem related to your vitamin K dependent coagulation factors. As a review, your vitamin K dependent coagulation factors includes your factor 2, 7, 9, 10, protein S, protein C, and protein Z. So, making this one as our acquired disorders because it involves several coagulation factors problems. Liver disease. Remember here that the liver is the one really producing here our coagulation factors. So, majority of your coagulation factors are produced by the liver. So, if your problem with the liver, it will affect the production of your almost all your coagulation factors. Therefore, liver disease considered as acquired kasi it involves here several coagulation factors problem. Then we have also your fibrinolytic defects. DIC is also acquired. Your DIC is your disseminated intravascular coagulopathy. Again, pag congenital, isang coagulation factor lang problem natin. Pag acquired, madami kang coagulation factor problems. So we start our coagulation factor disorders with the inherited na coagulation factor problem. We have your hemophilia A. Hemophilia A is inherited. Is inherited disorder, congenital disorder that's being inherited as sex-linked recessive. Kung sinabing sex-linked, ang carrier ng abnormal gene natin, recessive gene, is the female na mother. Pero ang nagmamanifest ng hemophilia ang kaniyang anak na lalaki. So, unfair, di ba? Sa babae, ang nagkikarry ng abnormality na gene, pero ang nagsasuffer is the lalaki na anak. Okay, we have here factor 8. Again, hemophilia A is characterized by decreased concentration for factor 8. Usually, mga less than, pinaka-cut off natin is 30%. Okay, 30, less than 30%, sobrang baba na niyan, you would have your manifestation of that. Okay, anyway, may classification tayo later on ng based on the concentration. The more na mababa ang concentration ng factor 8 natin, the more severe your bleeding manifestation. Okay, bakit ka nagbe-bleeding dito is because hindi ka nagka-clot formation, di ba? So remember that your coagulation factors, it's much stable in terms of its formation of the clot compared with the platelets or even your blood vessels which are involved in the primary hemostasis. So pag may problem ka sa coagulation factors, most likely you suffer here with the bleeding manifestation. Okay, we have the incidence of that one in every 10,000 live births would have here manifestation of your hemophilia A. And they consider also here the hemophilia A as the royal disease, although you belong to the royal family, pero we don't want naman na, 'di ba, na magkaroon ng hemophilia. Royal disease because several mga prominent na royal families would have here the hemophilia manifestation like Queen Victoria of England or even Nicholas II of Russia also have here hemophilia. So we have here the inheritance pattern of your hemophilia A. So again, ang ating abnormality will always be the X chromosome ni mother na recessive. So itong problem natin. In this one, try to code here for the hemophilia manifestation. So, granting for example, the father is XY. So, this is the normal na father, X chromosome at Y chromosome sa lalaki. At ang mother natin, siya ang carrier ng recessive na X chromosome natin. So, ano magiging tendency? What will be the probability of their children in terms of the manifestation of the hemophilia? So, perform here the Punnett square. So, the father here, X and Y of the father. And the mother natin, X, saka XR, which is the recessive na chromosome here, which is the one carrying the abnormality for your hemophilia. So, i-perform lang Punnett square. So, XX, so that's your XX. X saka XR, that's X saka XR. Tapos ito naman, X saka Y, XY, XY, XR saka Y. So, ito siya. Ano ibig sabihin nito? Pag XX, so normal na babae. Normal na daughter. Wala siyang hemophilia, hindi siya carrier. Okay, pag XY lang siya, wala kang recessive. So this one is your XY. So that's represent here the normal son. This one X, saka XR. So R again, this is the recessive na gene. So this is XX. So babae ito. So carrier na daughter. So meaning to say, the daughter here try to carry your recessive gene na pwede ipasa sa magiging anak niya din, na pwede siya magkaroon ng bleeding manifestation. Remember, pag carrier ka dito, you do not manifest a bleeding manifestation. Then for the hemophiliac son, we have here X. So ito na siya, XR, recessive gene, and Y4. This is the lalaki na anak. Pero, again, meron siyang XR, which is your abnormal na chromosome. And this represent here your hemophiliac son. Ito ang magmamanifest ng bleeding manifestation. So, ganun lang, if you wanted to know what will be the probability pag ito ang gene, for example, ng father, ito ang mother, whatever the given, just perform the Punnett square, and therefore you could determine the percentage. So, anong interpretation natin dito? 25% na normal ang daughter, 25% normal ang son, 25% carrier daughter, and 25% of the children become a hemophiliac son. Okay, then we could also classify your hemophilia A manifestation according to the severity of the bleeding manifestation. Again, the severity of the disorder here is likely related to the concentration of your factor 8. So the lower the concentration of your factor 8, so the more bleeding manifestation, the more severe your disorder. Okay, so we have that. If the coagulation factor 8 is only 1%, sobrang baba niya, we consider that one as a severe form of our hemophilia A. and that would have here characterized by spontaneous and exaggerated bleeding manifestation even during the infancy or childhood. 1 to 5% concentration factor 8, we consider that one as moderate. It's being diagnosed in the early childhood when the patient tried to manifest a bleeding manifestation. 5 to 30% medyo mild lang siya, but still consider here as our ano pa rin siya, manifestation, consider pa rin siya as hemophilia A. 5 to 30% will be characterized by still the patient would have a risk of bleeding manifestation or hemorrhage following a significant trauma. And may bleeding manifestation pa rin siya or bleeding tendency if the patient undergo here surgical operation or even dental tooth extraction. So, pag na-notice ko minsan, nagko-comment ang dentist na sobrang bleeder ang patient, it might be a sign of your hemophilia. Okay, then we have also here, sometimes since mild lang naman ito, it might eventually the patient go asymptomatic. Okay, so dapat not less than 50% ang ating factor 8. That would be, pag less than 50%, then it might have here the bleeding manifestation related to that. Okay, we have here the manifestation of your hemophilia A. So the bleeding may occur here different part of the body. So deep muscles, your joints, urinary tract. We have also intracranial, nasa head the patient. Okay, it also have here recurrent hemarthrosis. Hemarthrosis came from the word hema, which means bleeding or blood. And throsis here, arthro is your joint. Not throsis, but arthro. That's your joint. So, it would have your manifestation of the bleeding in the joint. And medyo masakit ito pag nasa joint. Nagkakaroon siya ng hemarthrosis after a significant trauma like nabunggo siya sa surface. So, after a significant trauma, after 8 hours or even after 1 to 3 days for some patient, doon na namumula ang mga injured area, nagkakaroon ng pasa, nag-inflame. So yun, medyo masakit siya because it would have a joint manifestation. That's your hemarthrosis. Okay, if you encounter, for example here, mga case study na may nakalagay na manifestation of hemarthrosis, so you suspect na what is involved with that will be the problem with the coagulation factors. Pag ang problem lang natin ay mga platelets, mga primary hemostasis lang natin, like your blood vessels, platelets, wala siyang hemarthrosis. Pag may hemarthrosis na signs symptoms, suspect for the coagulation factor problem. Okay, how are we going to know here, how are we going to diagnose with a patient with your factor A deficiency of hemophilia A? So, APTT would have your prolonged result. Why prolonged? Because your factor 8 belongs to your intrinsic pathway, which is being measured by our APTT. And therefore, since mababa ang level ni factor 8 patient natin, so hindi nagkakaroon ng clot agad. Usually kasi mga coagulation studies natin like APTT, prothrombin time, those are clot-based. Pag sinabing clot-based, pag nag-test tayo, ita-time natin kung kailan magkakaroon ng clot formation. Since dito, hindi siya agad nagkakaroon ng clot formation because kulang siya ng factor 8. So, expect mo na magpo-prolong ang result ng ating coagulation studies. And specifically for your APTT. The prothrombin time and your thrombin time, it would have a normal result. Normal dito sa prothrombin because again, it belongs to your intrinsic pathway, ang factor 8 natin. So, it will only affect the APTT but not your prothrombin time. Hemophilia B or your Christmas factor is basically problem with the concentration for factor 9. So this is like the factor 8 also. This is also sex-linked then recessive. Okay, so same mode of inheritance with the factor 8 or the hemophilia A, but the factor B, okay, is characterized here by the decreased concentration of factor 9 natin. So making this one as your hemophilia B. Okay, decrease din siya, so less than 50%. Incidence, 1 in every 25,000 or 1 in every 30,000 live births would have been affected by our hemophilia B. So, medyo mas madaming prevalence, mas more prevalent ang ating hemophilia A kasi hemophilia A is 1 in every 10,000. So, mas madaming incidence ang hemophilia A compared with this one, 1 in every 25,000 to 130,000. To 30,000, I mean. Okay, so in order for you to differentiate factor A, factor 9, perform the specific na factor assay. Okay, perform here your factor 9 assay concentration. Since the problem is factor 9, so expect na mababa ang ating level ng factor 9 that would identify your hemophilia B. Okay, laboratory diagnosis would have here the same manifestation lab test result with your hemophilia A. APTT then ang prolong. Why APTT? Because again, the problem with this hemophilia B is your factor 9. Factor 9 still belongs to your intrinsic pathway, and therefore it will be monitored here by our APTT because APTT tend to measure your intrinsic pathway and common pathway. Prothrombin time and thrombin time would have here the normal result. So, since pareho dito ang result niya, so like for example, nag-perform ka ng APTT, pareho naman dito, ano pa naman lamang kay hemophilia A or hemophilia B, then perform your factor 8 assay or factor 9 assay. Pag factor 8 assay, may measure mong concentration ng factor 8. I-measure mo din concentration ng factor 9 for the factor 9 assay. Kung alin doon ang mababa, that will identify your hemophilia. Pag mababang factor 8 ang concentration with the normal values, then hemophilia A. Pag mababa ang level ni factor 9 sa factor 9 assay, so that's your hemophilia B. That's how you're going to diagnose it. Okay, then we have also here the hemophilia C. So hemophilia C, the problem with your factor 11 deficiency. So this is a problem with your PTA plasma thromboplastin antecedent. That's your Rosenthal factor. So this one is inherited as autosomal dominant, hindi siya sex-linked. Just like your factor 8 and factor 9. Very common among Jewish people. So ito lumabas sa board exam 2 years, yung first batch natin, itong lumabas sa kanila. Very common among Jewish people daw. Laboratory diagnosis here to identify your factor 11 deficiency would be your APTT pa din for long. It's because here again, your factor 11 still belongs to your common pathway pa din siya. PT would have a normal result with that. So, para ma-identify siya na factor 11 deficiency, so still perform your specific factor assay with identification of your factor 11. So, mababa ang level ng factor 11, that will identify your hemophilia C. Factor 7 deficiency related to your dysproteinemia. So, as we have discussed sa mga disorders natin, your paraproteins, mga paraproteins natin, it inhibit your fibrin polymerization, and therefore the patient would have your bleeding manifestation. So this would have your moderate to severe bleeding manifestation. Since factor 7 belongs to your extrinsic pathway, so ang affected na test natin will be your prothrombin time. It will have a prolonged test result with the prothrombin time, would have a normal result with our APTT because, again, this is not included in your, because factor 7 belongs to your extrinsic pathway, so dito siya sa PT natin. Another one, we have your factor 10 deficiency. So this one related to your paraproteinemia, amyloidosis. Amyloid is toxic protein. So pag nakadeposit siya sa ating mga blood vessels, it will result here to eventually damage. Anyway, kung saan naman siya magdideposit ang ating amyloid, it become destructive. Sinisira niya. And also related to your antifungal treatment. Okay, factor 10, so laboratory test, factor 10 belongs to your common pathway. And therefore, pag prolong your PT, this is again your extrinsic pathway, this is your intrinsic pathway. Since common pathway siya, so both of that will have your prolonged result. Pag both of your PT-PTT are prolonged, we are considering that the problem is in the common pathway. Common pathway includes your factor 10, 5, 2, 1. Since factor 10 deficiency ito, so common pathway, and therefore it will have prolonged for both your PT and the APTT. But we still have here pinaka-specific test for the common pathway, Russell, Viper, Binom time, or your Stephen time. So, this is the test for the common pathway. So, therefore, it would have your abnormal result when you have problem with your factor 10. Because factor 10 belongs to your common pathway. Then we have here the factor 13 deficiency. The factor 13 deficiency, factor 13 anyway, is needed para mag-polymerize ang ating fibrin polymer, mag-cross-link para magkaroon ka ng stable na clot. Diba? Pag na-convert ang fibrin to your fibrin clot, hindi enough na hanggang doon ka lang dapat para mag-stable ang clot, hindi siya masisira agad. kailangan siya is cross-link ng ating factor 13. So, this how important your factor 13. Pag hindi ka or wala kang factor 13, ang mangyayari niyan ay agad-agad nasisira ang clot natin. Hindi siya ganun ka-stable. And therefore, ang magiging effect, moderate to severe systemic bleeding with poor wound healing. Hindi mag-heal ang wound natin kasi hindi pa nga siya nag-clot effectively, 'di ba? So, masisira na agad siya is because wala kang factor 13. Okay, so the fibrin clot produced here by the patient na may factor 13 deficiency considered to be a weak clot which dissolves in your 5-molar urea. Your 5-molar urea solubility test, we call this one Sir-Dakard's test. Notice here that coagulation studies, PT and PTT are all normal because your factor 13, hindi siya nakabilong sa ating intrinsic pathway, hindi siya nakabilong sa common pathway, hindi rin siya nabilong sa ating extrinsic pathway. And therefore, the proton beam time PTT test result here will have a normal result. Pero dito siya, this is specific test for your factor 13 deficiency, your Dakard's test, or your 5-molar solubility test, that will eventually produce a insoluble na clot, okay, that would easily be dissolved by your 5-molar urea or your 0.1 hydrochloric acid. Anyway, we'll discuss naman mga tests sa last part when we go different tests for evaluation of your coagulation factors. Okay, then we have your factor 13. Again, the factor 13 is made up of two subunits. Okay, we have here the alpha and the beta subunits. The alpha subunits basically produced by your megakaryocyte and monocyte. So, dito yung pinaka-active na part ng ating factor 13. The beta subunit, on the other hand, is the binding, stabilizing the function of your alpha subunit that was being produced by our EC or our endothelial cells. There are three types of your factor 13 deficiency, type 1, type 2, and type 3. So they're differentiated, number 1, by their frequency. Type 1 is rare, frequent, rare. Okay, so then we have your factor 13. Okay, so factor 13 activity. So factor 1 absent, absent, low. Beta subunit nila absent, normal, absent. And there are also these three types also differentiated by their alpha subunit concentration. The alpha subunit concentration absent in your type 1, low here, low, and low here in your type 2 and type 3. Okay, then we have also here the summary of the entire bleeding manifestation of the different coagulation factors. Factor 1 deficiency related to your fibrinogen. So, tatlo ito. The first one, afibrinogenemia, hypo, and dysfibrinogenemia. Pag sinabing afibrinogenemia, wala ka talagang fibrinogen level. Whereas your hypofibrinogenemia and your dysfibrinogenemia are basically would have here the fibrinogen concentration of less than 100 mg per dl. Mababa pa din because the normal fibrinogen concentration natin is nasa 220 to 498 mg per dl. Sa kanya is less than 100, so mababa. Factor 2 deficiency 5, factor 7, 10, okay, would have here identified if the level of their factor concentration is less than 30% compared to the normal. Factor 11 deficiency would have here less than 50% of the factor 11 concentration. And factor 13, so less than 1% na lang siya, sobrang baba niya. And we have here their relative na bleeding manifestation. So, afibrinogenemia, ang kanyang bleeding is severe anatomic bleeding. Your hypofibrinogenemia would have here the moderate systemic bleeding. Your dysfibrinogenemia, factor 2 and factor 5 would have here mild systemic bleeding. Factor 7 would have here your moderate to severe anatomic bleeding. Factor 10 is your severe anatomic bleeding. Factor 11 would have your anatomic bleeding. And factor 13, ang kanyang bleeding manifestation is severe to moderate systemic bleeding with poor wound healing.